Hey, Dr. Robert Inesta here from Westchester Sports and Wellness. The main premise behind what we do here, the treatments that we provide, is that we're improving movement. Right? We want to get people moving better. That's really the goal. And this is happening on many different levels, okay? It's more than just the gross movements of the body, right? Our musculoskeletal system moving us through space, right? In order to get from point A to point B, or to use our arms and our hands to perform tasks, to turn our head. Obviously, yes, that is movement, and that's a big part of what we do, but we're also talking about movement on the internal level, at the cellular level, the functional level. Because if you think about it, even when we're still, like when we're meditating or when we're sleeping, there's still movement happening within us. There's a lot of movement actually, right? When we breathe, our diaphragm is contracting and expanding our rib cage, right? Making room so the lungs can expand to pull in gases. And then when it relaxes, right, the rib cage then contracts again and the lungs shrink a little bit and we exhale and we push out waste gases, carbon dioxide and other waste particles. So that's happening all the time. Right? Our heart is always beating in order to push blood through the blood vessels and to nourish our cells and tissues, and also again to carry wastes out of the cells and away from them, and then eventually out of the body. So very important function. The nervous system, right? There's this electrochemical signaling process that's happening. So information is being carried to the brain from all of the different parts of the body, right? All different nerve endings interpreted in the brain, and then the nerve is then sending signals back down to those target tissues to orchestrate activity, right? How to move, what to do, organ function, all these different things. So there's a lot of movement happening. There's ion transfer, these little ions moving in and out of the cells in order to make that possible. If you look at the connective tissue system, right, there's mechanical force or mechanical energy that is being transferred through the body. And that's actually faster than nerve transmission, which is very interesting. But that's significant in terms of muscle coordination and just activity in general, even organ function. So movement's happening on so many different levels, all the way down to the cellular level. So when we say that we're improving movement, again, it's a lot more than just getting you from point A to point B more efficiently and getting your muscles to work better. Again, it's a big part of it, but there's a lot more to it. So the treatments that we use, like acupuncture, which is an amazing system, right? It's a complete system that allows us to really influence that electrochemical signaling transfer. So we're influencing the nervous system, we're influencing the fascial system, so that mechanical energy, intercellular communication, cell-to-cell communication is influenced by acupuncture. It also allows us to release tension from the muscles and the connective tissues. So there's so much that acupuncture does, and that's explaining it in terms of Western science, right? Traditional Chinese medicine explain it in a different way, but it's still based on movement. We're trying to facilitate the normal movement of qi, or subtle energies, through the body. So again, it's all about movement. The manual techniques that we use, functional soft tissue techniques such as fascial manipulation, which is an amazing technique for releasing tension in the fascial system, and again, allowing that normal muscle coordination to happen. Active release technique, another amazing technique, ART, again, to release tension from these tissues, from the muscles, from the connective tissues, and allow for easier movement. Joint manipulation, right? Chiropractic joint manipulation to normalize the joint mechanics, which again then affects the nervous system, it affects the whole, the biomechanics of the entire body. And the nutritional interventions, which help to support the biochemical level, which is obviously, you can't emphasize enough how important that is. So that's what we do. That's basically how it works. That's our philosophy and how we apply these treatments. And again, they're all based on the needs of the individual. So we'll do a thorough assessment, thorough exam, and then based on what that individual needs, we'll tailor a unique treatment plan for that individual. So I hope you found this useful. I hope it answered some questions. You found it valuable. Feel free to share this with anybody who you may feel could benefit from what we do. All right, thank you so much for watching.